I'm Dr. Bill Burman. I'm the Director of Public Health at Denver Health, and I'm happy to report that the COVID situation continues to steadily improve. So case rates, percent positivity, hospitalizations, all continue to decline. The rates are still higher than we would like them to be. They're not down as low as they were at times during the summer last summer, but the direction is good and the level is reasonable. We continue to move forward quickly with vaccination. Just under 10% of the Denver population has now been vaccinated. Of course, the initial focus has been on healthcare workers and those who are 70 years of age and older. Starting Monday, we're able to expand to school staff in ECE through 12th grade. And so I'm happy to report that DPS staff are being vaccinated as we speak. Here locally, we've seen decreases in healthcare workers and decreases in persons of 70 years of age and older, precisely the groups that have been targeted for early vaccination. So, yep, all the data says that the vaccines are working very well in the way that they were intended to. That's a great question, and one we need more data on. I think there are two sources of at least preliminary data that bear on this question. One comes from the trial of one of the vaccines we're using, called the Moderna vaccine. They assessed among all of the more than 30,000 people who were involved in that trial at day 28, that is 4 weeks after the initial dose, whether the vaccine had an effect on asymptomatic carriage of COVID. The main results of the study showed already there had been a decrease in symptomatic COVID by that time point. What this analysis showed was that asymptomatic COVID was also markedly decreased in those who had received the vaccine. The second study that was just released was from another vaccine which is not yet licensed in the United States, one from a company called AstraZeneca. And in a somewhat similar analysis of a study done in the United Kingdom, they showed a reduction in asymptomatic carriage of COVID in persons who had been vaccinated. So the preliminary data says that the vaccines decrease asymptomatic carriage, don't abolish it completely. So yes, I think they're going to decrease transmission, but we all need to remain vigilant because they don't completely abolish, that is, take away asymptomatic carriage and hence the risk for transmission among people who've been vaccinated. Yeah, I think the main thing that will have an impact on is whether the need to quarantine a teacher because of exposure, because the Centers for Disease Control and others have released guidance that says that persons who have completed a vaccine series do not need to quarantine after an exposure. We're still working with the State Health Department to confirm that that will be applied to teachers. I think it will be. And so that will be a big deal for the schools, because one of the challenges of running a school for in-person learning during the COVID pandemic has been shortages of teachers, in part caused by quarantine. So I think the effect on quarantine will be very important. We, by contrast, do not expect any change in the application of the DPS-5. So masking, distancing, hand hygiene, symptom screening, all will go forward as they are now.
If indeed you're feeling ill at all, you really need to stay home. And that's somewhat different than in the past, where, as a parent or as an instructor, you've said, let's just see if those mild symptoms get better. And that's not the case with COVID. We really want people to stay home with any type of symptoms.
Yeah, we want to encourage the families to have students with symptoms that are in any way associated with COVID to arrange for testing as quickly as possible. The variant that is of most concern at the present is the B117, the so-called United Kingdom or UK strain, and that strain is characterized by an increased risk of transmission. Importantly, it's not characterized by a decrease in protection from the vaccine. The vaccines appear to be fully protective against the B117 strain. So with a more transmissible strain that is uncommon, but occurring in our community, should we change the recommendations about masking? There's no clear guidance or proof that double masking is better than single masking. I would put the emphasis on, first, assuring that masking is used as directed, and secondly, minimizing any risk of transmission for periods of time when masks need to be off. For example, lunch, snack, and other activities. I think there's a lot more to be gained by focusing on those two things than on focusing about whether 2 masks is better than 1.